Around 16,000 positive cases have gone missing from the test and trace data. Why should people have confidence in your ability to track the virus if you can't even track the data?
Well, what happened here, Paul, was that there was some of the data it got truncated and it was lost. But what they've done now is not only contacted all the people who were identified as having the disease. I mean, that was done in the first place. But they're now working through all the contacts as well. And the key thing I would say is that, and it goes for everybody, is that if you're contacted by NHS Test and Trace, then you must self-isolate. If you're told you've been in contact with somebody who has the virus, you must self-isolate. There is support of £500 for doing so, and of course a £10,000 fine if you don't.
Does the government have any idea how many people should have been traced who haven't been traced because of this data mix-up?
I can't give you those figures, Paul. What I can say is that all those people are obviously being contacted, and the key thing is, as I say, that everybody, whether in this group or generally, should self-isolate. That's the way to make it work. £500 if you do per week, and a £10,000 fine if you don't. And what that does is it creates a firebreak around the incident and helps us to fight the virus.
Do you worry that, given once you add in these positive cases, the number of cases is rising faster than we initially thought, perhaps the restrictions you've introduced aren't having the kind of effect that you'd hope they'd have?
I think that's a very good question, but actually the incidence that we're seeing in the cases really sort of corresponds to pretty much where we thought we were. And to be frank, I think the slightly lower numbers that we'd seen, didn't really reflect where we thought the disease was likely to go. So I think these numbers are realistic. The crucial thing is that in the next few days, week, we'll see more clearly whether some of the restrictions that we've put in, the extra enforcement of the rule of six, the extra enforcement of self-isolation, the rules on masks and so on, all the stuff that has come in, we'll see whether that starts to work in driving down the virus. But this is all very much in our hands collectively as a country. If we follow that basic guidance, and we all know what it is, but it can't be repeated often enough. Hands, face, space. Get a test if you have symptoms. Self-isolate if contacted, and so on. Then I've no doubt that we will be able to get on top of it, as indeed we did earlier this year.
There is now a complex patchwork of local restrictions in place. When will the government be making an announcement on simplifying that, perhaps with a three-tier traffic light type system?
Well, one of the difficulties in fighting the pandemic is you keep having to adjust the strokes you play, the shots you play, depending on where the virus is and the effect it's having in different localities. And it's certainly true, as Chris Whitty and others have said, that it seems more localised this time than it was in March and April. That's how it has been anyway. And we will be taking steps, as you can imagine, constantly to keep guidance, keep advice as simple as we can. When there's more to say on that, we'll certainly be saying it. But for now, it's, follow the local rules in the areas which are under special restrictions. Get on the website to look at what you need to do. But generally, it's all the restrictions that you know.
But is it your intention to simplify the system with a three-tier approach?
Well, we want to keep the system as simple as possible.
In terms of a vaccine, lastly, Prime Minister, is it the case that everyone should expect to be able to get hold of that vaccine if and when it is available?
Well, we don't yet have a vaccine, unfortunately. Paul, we're working very, very hard to get one. I went to see the scientists at Oxford at the Edward Jenner Institute, the AstraZeneca team. Incredible what they're doing. You really feel that they must be on the verge of it, but it's got to be properly tested, it's got to be properly validated, and we're not there yet. Obviously, if and when we get a vaccine, then the crucial thing will be to ensure that we have sufficient supplies in this country, that we're able to make it in this country, distribute it fast in this country, and clearly the priority for a vaccine will be, as I think Kate Bingham and others have said, will be those who are the most vulnerable groups. That's how you'd start.
Okay, Prime Minister, thank you.
Thank you.